I am Jeanie, Jeanie Tryggestad, Tryggestad. I'm Associate Professor of Pediatrics at Children's Hospital in the Jonas Chair within the section of Diabetes and Endocrinology.
So give us an overview of what you're seeing.
So this started back in March with the COVID pandemic, and since then we've been following our numbers of diabetes, and they have risen quite a bit. We've seen that not only in our new onset patients, but those that are having new onset diabetes and being admitted into our ICU as well. All across the board, we are seeing higher numbers of diabetes, especially in children.
Interesting. Now, there's an argument to be said that Oklahoma we get high numbers of diabetes as it is, and that they have been steadily increasing, I think, over the years. But how is it in contrast to that?
Absolutely. So we have been able to look back in our section over the last 5 years of data, and we're seeing a pretty dramatic increase, upwards of approaching 20%, just in this 1 year time frame. So there's been a very dramatic increase. And let me take a moment to try to explain the differences in diabetes that we see in children. So the most common form of diabetes in children is type 1 diabetes. Type 1 diabetes exists because the body has attacked the cells, specifically what we call the beta cells, that make insulin in the body. And so you are no longer able to make insulin, and you are dependent on getting insulin injections every day. And so that's the most common form of diabetes in children. Now, we also see type 2 diabetes in children, and that mirrors what we see as far as the state of Oklahoma. So with type 2 diabetes, this is usually related to insulin resistance. So in other words, you can make insulin, but it's not enough. Your beta cells in your pancreas can't keep up with the demands of your body, and that's when you develop diabetes. And so we've actually seen increases in both forms.
And so I thought, and my naivety, I'm sure, but I thought that type 1 was something you're born with, and type 2 you may acquire, or is that wrong?
No, type 1 actually develops over time. There are some diabetes forms that you're born with, but those are related to genetic mutations. Specifically with type 1 diabetes, this is an autoimmune response, so we see this usually in early childhood.
So obviously, COVID has only been here in Oklahoma less than a year, just coming up on a year. Is there a way to know that there's a correlation between these things, or is just right now it's just a hypothetical situation?
We're really working on that, but we're not only seeing this in Oklahoma. There was a recent report out of the Washington Post that they're seeing this across the country, where we're seeing this increase in case. So it at least makes us think that there is something going on with COVID. And to try to answer that, there are many people across the nation looking at different cohort studies to try to look at this relationship and understand specifically what it is about COVID that may be triggering this increase in diabetes.
So when you have a new onset diabetes patient now in the pediatric clinic, do you check them if they, obviously you ask had they had COVID, do you check the antibodies, just to see if maybe they've had COVID? Or?
So a lot of times they're actually coming through the hospital. We're actually seeing quite a few coming in a severe form of diabetes, which we call Diabetic Ketoacidosis, where they are so insulin deficient that they have acid buildup in their blood and require an admission to the ICU. And anytime they're admitted to the hospital, we are obviously checking for COVID, so we have that, and a few of them we have checked antibodies on in the past as well. It brings up an point about antibodies, though, and that's one of the things that we do to test to make sure that this is type 1 diabetes, and that we test the diabetes antibodies for everyone to assure which type of diabetes that it is.
So are there, from pediatrics, are you seeing it more commonly starting, is it acquiring at specific ages, or is it just pretty much all over the board?
It's all over the board, but there are definitely spikes in specific ages. We usually see an increase in the incidence of diabetes in those in kind of the 7-year age range, and then there's another kind of peak that happens around the start of puberty. So those are kind of the two ages that we see it a little bit more commonly anyway.
Gotcha. So at this point, do you have is there a suggested idea of why COVID might be affecting diabetes, or diabetes might be affecting COVID?
Absolutely, and that's a great question because there's a lot of research going on right now. The way that COVID gets into the cells is through a specific receptor, this ACE2 receptor. And so there's a lot of studies and things going on right now to see if there are these receptors on the beta cells, those cells in the pancreas that make insulin. And the results so far haven't been conclusive. Some people are saying that maybe there is, but in the setting of COVID, we're not sure if that's really the mechanism that it's getting into those beta cells. So I think we will know more coming forward, but that's a great question. It's something that is actively being explored.
So why again, it's still very new. I mean, in terms of researching things, illnesses, the correlation would be very, very new still, I would imagine. But is there a chance that then maybe post-COVID that some of these kids, they'll reverse, or I mean?
Well, that's a really good question. And it goes back to what I was saying a few moments ago about checking the diabetes-specific antibodies. Because if those diabetes-specific antibodies are there, the chances of it going away are very, very slim. That's going to be a permanent effect, and that's going to be permanent type 1 diabetes. It's going to require insulin treatment for the rest of their life. Now, if this is type 2 diabetes, where the antibodies are not present, we know that the blood sugars and the insulin resistance during COVID is quite a bit higher. And so is there a chance after recovery that some of those that are diagnosed with new diabetes that looks more like type 2, that it might recover and might get better? Maybe. Again, we don't know enough yet about the effect on that beta cell of whether that's permanent or not.
And so for type 2, a lot of those patients have to do with lifestyle, right?
So in adults, the primary treatment or the first line of treatment is definitely lifestyle. However, with type 2 diabetes, we know that this is very, very aggressive in children. I've been involved with one of the largest cohort studies, our TODAY study, so that's treatment options for diabetes in adolescents and youth. And we know that diabetes in youth is rapidly progressive. From that early study, we know that about half of them failed therapy with metformin alone within 2 years. So in youth, this is very aggressive, and type 2 treatment in youth requires not only lifestyle but medication intervention. Usually that starts in the form of metformin, and then depending on kind of what their control is and what their initial presentation, how high their initial glucose is, a lot of them initially need insulin therapy as well. And in the setting of COVID with this insulin resistance, the insulin that's being required for our patients with type 2 diabetes that is admitted are going up pretty dramatically as well. So they have quite a high insulin need.
So what you said, a lot of them are coming in through the ER because they're very sick. So what are some things that parents need to be keeping their eyes out for?
That's a very, very good question. And I think right now there's been a lot of fear to come in for fear of coming in contact with the virus. But specifically, if we're worried about diabetes in a child, if we have a child that has increased thirst, so they're having to get up multiple times during the night to get water, or maybe they're just continually drinking through the day. If they have increased urination, so they're maybe even wetting the bed for someone that has previously been completely dry through the night, or as some families tell us, maybe we've gone on a car trip and we have to stop every few minutes. Those are some of the signs of diabetes, along with weight loss. And so being very vigilant about that. As this progresses further and that acidosis develops, there can even be some changes in breathing. So, and a lot of times there's vomiting as well. So any of those, we would encourage you to come in earlier so that we're not to the point of the severe acidosis. And so not being afraid that if there really is a concern to come on in or be seen.
So not necessarily wait till you need to go to an ER, but talk to your child's pediatrician?
Absolutely. Talk to the pediatrician, and they will be in contact with us. That's absolutely one way. But if we are very sick with the vomiting, with the strange breathing, not being afraid to come on in. At that point, it's much more important to come on in, be seen, and let us evaluate.
And have you, the last few weeks we've heard all this news about the MISC, and so is there any other kind of correlation with this and diabetes as well, or just simply?
I think we don't know yet, but MISC definitely is evident in children and a complication. Now, we have had some of our patients, specifically those with type 2, that have also presented with an MISC picture, so they can both be there.
So for patients that, your children that have had diabetes for a while, I mean, it's very critical that they are staying safe from COVID, right? Because that can definitely make things worse for them.
Right. And so, we have several large cohort studies, and those with type 1 diabetes specifically, if they come in contact, what we have seen, or what the trend is that helps them stay out of the hospital, is their technology. So what do I mean by their technology? So in diabetes, we use continuous glucose monitoring. We use pump therapy, things like that, to try and assist. And one of the things that has been shown to try to reduce some of the hospital admission is the use of that, specifically the continuous glucose monitor, to have a better idea of what's going on with the glucose and intervene quickly if there are changes.
I don't have any other questions. Is there anything that I didn't ask you that you want to?
I really think, the takeaway points are, yes, diabetes is increasing, and it seems to be in relationship to COVID. We're going to be doing more on that to see that. Number two is that it does affect children, and those with type 2 diabetes specifically seem to be getting more sick, and they're requiring more insulin. We have seen MISC in these children with type 2 diabetes for sure. And then the use of technology and the broad availability for technology is going to be critical to keeping the kids safe and keeping them healthy.